Hello, I'm Dr. Ann White. We're here today at Carolina Laser and Cosmetic Center to do a demonstration of a new filler offered by Galderma called Restylane Define. Restylane Define is used around the mouth and can also be used in the lips to provide a natural looking appearance of the filler, even with movement of the mouth, which differentiates it from some other fillers. In addition, Restylane Define can last, in my experience, up to 1.5 to 2 years, which is a longer duration than other fillers. So we're here with Samantha Martin, our CMA, and Tamara is my administrative assistant and medical assistant. And Jennifer, my front office receptionist, is going to be asking us questions off camera. So Tamara, what specifically are you interested in improving?
Marionettes in my lips.
Okay.
The corners.
You'd like to have your lips turned up a bit?
Yes.
And maybe a little bit fuller?
Yes.
Is that correct?
Yes.
Okay. All right, so Tamara's already numb for about 20 minutes, so she's good and numb. We've got a Zimmer chiller. It's a cold air device to blow cold air on her skin to make the procedure more comfortable. And we'll get started. So Jennifer, you can ask questions anytime if you like.
Okay, so what are the lip fillers made of?
Lip fillers are made of hyaluronic acid, which is a normal component of the dermis. It's actually a sugar. So you're just replacing what the body loses over time naturally. So I'm going to get started here a little bit. If you'll hold your question for just a second, Jennifer. All right, this is a little bit of alcohol, and Tamara, feel free to lie back for me. I think you'll be more comfortable that way. All right, so we're going to start here at the very end, and you can go ahead and ask another question,
Okay.
Jennifer, if you like.
So what is the best filler for lip augmentation?
I love the Restylane family of fillers. If we were just going to do the lips themselves and not do the area around the lips, I probably would choose Restylane Silk. It's very smooth. But since we're also doing the marionettes and the nasolabial fold, I'm going to use the Restylane Define instead of Tamara's. Okay. Plus, you'll get the advantage of it will last longer, which is a nice advantage for her.
Okay, so what are the contradictions to lip fillers?
Contraindications to lip fillers would be pregnancy, breastfeeding, age under 22, although that's a relative contraindication, and if a patient's family is supportive of them or they're a model or an actress, certainly I would make an exception to that rule. An active infection, a bleeding disorder.
Okay. Can I resume normal routines after Dysport and Restylane?
You can. We tell our patients with Dysport not to rub down and into their eyes. If they need to rub their eyes on a given day after they've had Dysport rubbed up and out, because we don't want any diffusion of the Dysport into the muscles that lift the brow, because it can cause a brow droop afterwards if that's the case. So just hold off for a second here, Jennifer. And
Okay.
We'll get a little filler in here for Tamara. How's that feel, Tamara?
What?
Not too bad. Restylane Define's a little stiffer than Restylane Silk, so it really volumizes the lip nicely. Okay, let's see here. Alright, and I'm going to let you come over here and massage you for a bit. We're going to change sides here for just a second. And Samantha's going to massage for just a sec. And then Jennifer, you got another question for me?
Sure. Is exercise risky after a filler injection?
It's really not. Fillers are pretty well set after. The main problem we have is with our patients who like to go home and massage their fillers themselves. They can cause a movement of the filler. It probably is wise just to prevent swelling and bruising, not to do any exercise for about 24 hours after your lip fillers.
Okay. Are there permanent lip fillers? If so, what are my options?
Yeah, there are 2 permanent lip fillers internationally, Articol and silicone. Neither one is approved, FDA approved here in the States. There is one called Artifil, which is similar to Articol, which is actually little plexiglass beads suspended in collagen. The problem with Artifil is it can't be reversed if the patient doesn't like it. And there have been particularly problems with granulomas or lumps in the lips, so I don't use those fillers in the lips at all.
Okay. How long do different fillers last?
So fillers can last from 6 months to Restylane up to 2 years for the new Restylane Define and Refine. So the more you move a given area, the shorter the period of duration. So in the lips, fillers last a little bit less long, whereas in the cheeks or the nasolabial fold areas that you don't move as much, fillers last a longer period of time. Under the eyes, they can last a couple years.
Oh, wow, okay. And how much filler is in one syringe?
It's 1 cc or 1 teaspoon. So it's not a lot, but it's really all we need. So let's take a look at Tamara and see. Mark, if you'll zoom in there and take a look at the left side compared to the right side. And Tamara, what do you think so far?
I like it. It looks good.
Awesome. You want me to do the other side?
Sure.
Okay, let's do that. All right, let's have a little alcohol drop here. So Tamara, you'll likely swell tomorrow. Don't be surprised if you do. Some people swell more than others, but that swelling is usually worse in about 24 hours. Start over here. Let the lip lift. Open a slight bit. Got pretty good volume, so I'm just trying to give her a little definition mostly. We don't want her to have huge lips. They'd be out of proportion with the rest of her face, and she's got pretty good lips. All right, massage on that side for me. We're going to change sides here. All right, Jennifer, you got some other questions?
I
You'd
do.
like to hold it?
So if I don't like my filler, can it be dissolved?
Yeah, that's a great question. So that's the advantage of all. You know, we used to do collagen for fillers. The problem with collagen back in the 70s was it didn't last for very long. These fillers last a whole lot longer. And we had to do a patch test because a lot of people were allergic to collagen. With collagen or Radius or the Articol that we talked about, or Artifil or silicone, the fillers can't be reversed. The reason we do so many high hyaluronic acid fillers is because we can reverse the filler by dissolving it with hyaluronidase, which is Hylenex is another name for hyaluronidase. So it's a quick fix, and if you don't like your fillers, yes ma'am, they can be dissolved.
Okay. So now what are the costs for lip filler injections?
So Restylane lip fillers vary from $5.95 to $7.50. Restylane L is the least expensive, and the Define and Refine are the most expensive.
Okay. What is a recovery from a filler or Dysport treatment?
The main problem is swelling the next day, like we talked about with Tamara, and there also is a potential for bruising. If a patient gets a bruise, sometimes it takes a week for it to go away. We do have arnica bromelain here in the office that we can dispense to a patient should they get a bruise. And the arnica is a proteolytic, so it helps dissolve the bruise more quickly. The bromelain is an anti-inflammatory, so it helps with the swelling.
Okay. Now, what kind of pain should I expect during my treatment?
It is a little, we are using a needle, and the needles are very small. They're 30 gauge needles, so it does make a little prick in the skin, which can be uncomfortable. But we do topical numbing for 20 minutes, and we also use the Zimmer chiller, so most people find that the procedure is quite tolerable.
Well, I think I'm young. Do I really need it?
We have a lot of young girls come in for fillers, mostly in their cheeks and in their lips. So you can inject fillers not just for wrinkles, but to volumize and correct asymmetries. So probably the most popular areas with young people are their lips and their cheeks. Tell me what you think, Tamara. Think we need any more anywhere? Maybe in the nasolabial fold on the right, I'm thinking. Got a good lift. I like that. Marionette's better. Looks like this side may be a little bit deeper than that side. And I think we've got a little less, so we'll do a little bit more now. The young girls definitely love their lips.
So how long do you think before I see some results?
The results are instantaneous, just like you can see with Tamara. She's got results right now. It takes about 2 weeks for everything to settle in. Sometimes people get a little lumpiness right immediately after, which is why we massage. Some people don't massage, but we always massage patients, especially when they do their lips. That lumpiness takes about 2 weeks. It takes about 2 weeks for the filler to settle in and the lumpiness to go away. Okay.
So is there really any bruising?
There can be bruising. I don't think Tamara's got any bruising. We tell our patients routinely to avoid aspirin, Advil, Nuprin, any anti-inflammatory medications, vitamin E, fish oil, and alcohol before their procedure, at least 24 to 48 hours before, hopefully a week before their procedure, to minimize bruising.
Now, how does it feel after? Will I feel lumpy?
No, hopefully not. And like we talked about before, is we go to great efforts to massage so everything's nice and smooth. And if there is any residual lumpiness, it usually goes away within 2 weeks.
And how long do the results last?
The results can last from 6 months up to 2 years. So in the lips, not as long. In the cheeks and under the eyes, it can last a couple years. One advantage of the Restylane Define is it lasts longer than the other fillers we have for the lips. So the Restylane Define, the company will tell you 1.5 years, but in my experience can last 2 years.
Okay. So do you think that women are vain for wanting fillers?
Not at all. We don't even use that word in this office. The same self-esteem that makes our patients successful in their chosen fields, well-groomed and dressed, careful in their diet and exercise, leads them to get help for their appearance as well. Self-care is so important these days, and our patients just want to look their best. All right, so Tamara, what do you think?
I love it.
Hey.
Look great.
Good. Very good. So Tamara can go about her way in the next few weeks and tell our patients that she's had her lips done and her marionette and nasolabial fold, and that'll be so you can now share your personal experience with the patients, which is good. So I'm going to sign off now. I want to mention on March 26th we're having our big spring fling open house from 4 o'clock to 8 o'clock. So we have vendors, all of our vendors come for that event. We have $12,000 in prize giveaways. We'll have delicious hors d'oeuvres from Salem Kitchen, beer and wine, live demonstrations, and a selfie station. So we hope you join us then for that event. So until then, we'll say bye-bye.